Hello, everybody. Good afternoon. Wanted to do a quick Facebook Live to brief everybody on some of today's data and just reiterate a couple points related to the vaccine. First off, I want to congratulate President Biden and Vice President Harris uh, for their inauguration, and certainly in Onondaga County. We look forward to working with the new administration over the next 4 years, specifically and working together to help end this pandemic and then rebuild from the pandemic. So we're excited about the opportunity, and there'll be plenty of opportunities for us to partner in President Biden's old hometown here in Onondaga County. Uh, Looking at data today, today's a good day. For the first time in quite a while, we had no new deaths. So that certainly put a smile on my face, and we're very happy about that. Looking at new cases, 203 new cases, uh, third day in a row, I think, with 200 plus cases. This is, I think, maybe the lowest day we've had in quite a while. And for midweek, that's good. Normally, in the beginning of the week, we get lower cases. Thursday, Friday, Saturdays are our big case days, since we've seen an uptick since Halloween. Tomorrow will be a sign if we're continuing to see significant progress like we did last week. So far this week, the first 3 days, we're on pace to have a better week. So hopefully that will continue. Obviously, we know the deal here. We got to avoid gatherings. We have to stay at home when we're sick. When the numbers get lower and lower by avoiding the gatherings, and we start to starve this virus when we're sick, any symptoms, stay home, get a test. Let's rule out COVID every single time. If we do that, we'll be in pretty good shape moving forward. Uh, Positive rate, daily positive rate 5.2, good rate, 7-day average 5.5. That's right where we've been really the last 4 days. That's a pretty good spot to be in during the winter months. And if we can stay there, maybe get a little bit better, I think we're doing well. Breaking down hospitalizations, small little uptick. We got 195 in the hospital here. Again, that number was 337 3 weeks ago. So we've made a lot of progress. I think we had 190 yesterday. So a little uptick. Again, our hospital numbers in the work being done in the hospitals is heroic. I want to thank our hospitals, St. Joe's, Crouse, and Upstate, all their staff for the work that they've done. They are getting people in the hospital. It's not just one or two a day, it's dozens a day, but they're getting people better, and they're getting people better faster. So again, I want to thank them for that. The whole region, out of all of our hospitals, with all the members of other counties that come to our hospital, the number's 256. Again, we don't just service Onondaga County, we service really northern New York, central New York, and parts of southern New York at times in the southern tier. Um, Looking at the vaccine, we opened up 990 slots of vaccine. It's Wednesday. This week's Wednesday to Wednesday vaccination week starts today. We were given 900 slots. We have the ability to get 990 doses out of those slots, or out of those vials, excuse me. So we're given 900 vials of Moderna. We'll be able to get 990 shots out of those. And so we open up those appointments at 4 o'clock. It's highly likely that they will be taken very quickly if they're not already. This is a waiting game now. It looks like next week the state supply is going to be the same as it was for this week that we're now in, which means we don't anticipate having a lot more vaccine. Hopefully we'll get more than we got this week. Again, our appointments are new appointments. If you already have a registered vaccination appointment at the fairgrounds or Kinney Drugs, you keep those. You're going to get vaccinated. But we don't really anticipate much more happening at our clinic. We'll have a clinic on Thursday, and then we will start second shots next week on Monday and Tuesday, second doses for those who are ready for those. You will get an email if you haven't already. I think you have, and then you will get a email link. So Monday and Tuesday we will be giving second doses. Hopefully we get more vaccines. So next Wednesday, we can begin to give more first doses and second doses simultaneously. But with the vaccine, let's be patient. We're going to get through this. I know everybody's anxious, and we're working. One of the things here in Central New York we've done is all the categories have been treated equitably, and we're making progress each week. This week we'll vaccinate over 10,000 more residents than we had last week. So as we vaccinate more, that's how we fight back against this virus, and we're making a lot of progress. The distribution networks are here. Once the vaccine supply goes up, our underutilized county pod can do up to 18,000 doses a week. In addition to that, we have other facilities and other plans for larger vaccination pods, but also to then go and micro-target in communities, traditionally underserved communities, and communities that we haven't seen good data. We can micro-target vaccine distribution once we get more supply. So I think we heard the governor talk about it. Distribution isn't an issue. We don't need more distribution sites. We need to utilize the existing infrastructure, and we got a long ways to go. Again, we're doing 990 this week. We could do 18,000. So saying that, that's a positive. Once we get more supply, we're going to be very quick to get shots in arms. And this is the tool we have for people to get their lives back, to see your grandkids, to spend time with each other again. That we're doing it. We're going to get everybody vaccinated that wants to be. Nobody's getting left behind. Saying all this, I'll do another briefing tomorrow, but I just wanted to update everybody. Again, congratulations to our new president and vice president. Congratulations, Onondaga County. We didn't have any neighbors pass away over the last 24 hours. We haven't been able to say that in a while. Thank you.